Indications and usage. CALQUENCE is indicated in combination with bendamustine and rituximab, BR, for the treatment of adult patients with previously untreated mantle cell lymphoma, MCL, who are ineligible for autologous hematopoietic stem cell transplantation, HSCT, and as monotherapy for the treatment of adult patients with MCL who have received at least one prior therapy. Select safety information. Serious adverse events, including fatal events, have occurred with CALQUENCE, including serious and opportunistic infections, hemorrhage, cytopenias, second primary malignancies, cardiac arrhythmias, and hepatotoxicity, including drug-induced liver injury. The most common adverse reactions, greater than or equal to 30%, are diarrhea, upper respiratory tract infection, headache, musculoskeletal pain, lower respiratory tract infection, and fatigue. The most common grade 3 or 4 laboratory abnormalities, greater than or equal to 10%, are absolute neutrophil count decreased, absolute lymphocyte count decreased, platelets decreased, and hemoglobin decreased. Please see full important safety information at the end of the video. Please see full prescribing information, including patient information.
Hello, my name is Dr. Tycel Phillips. I'm an associate professor at City of Hope National Medical Center, located in Duarte, California. I've been practicing for the last 12 years in the management and treatment of patients with malignant B-cell lymphoproliferative disorders. In this video, we will be discussing the 3-year median follow-up data from the LY-004 trial of CALQUENCE in patients with relapsed refractory mantle cell lymphoma. When I look at follow-up study data for patients with relapsed refractory mantle cell lymphoma, I ask myself, are the safety and efficacy data at long-term follow-up consistent with the initial analysis? Are safety and tolerability data consistent with the established safety profile? What endpoints are most relevant to helping my patients achieve treatment goals? LY-004 is one of the largest clinical trials in relapsed or refractory mantle cell lymphoma. LY-004 was a phase 2 open-label, single-arm, multi-center trial of CALQUENCE monotherapy in 124 patients aged 18 or older with mantle cell lymphoma who had received at least one prior line of therapy. The primary endpoint was investigator-assessed overall response rate, ORR. Secondary endpoints included duration of response, DOR. The initial analysis had a median follow-up of 15.2 months. The long-term analysis had a median follow-up of 38.1 months. Now let's take a look at the efficacy data. The response rate of CALQUENCE was consistent in patients with relapsed or refractory mantle cell lymphoma and has continued to show deep responses over time. In the initial analysis at a median follow-up of 15.2 months, CALQUENCE demonstrated an IRC-assessed overall response rate of 80%, complete response rate of 40%, and partial response rate of 40%. In the long-term analysis, with a median follow-up of 38.1 months, CALQUENCE has continued to show deep responses, with 48% of patients having a complete response. Overall response rate was 81%, and partial response rate was 34%. Duration of response was measured in the 101 patients who achieved a complete response or partial response at the 38-month median follow-up. The median duration of response was around 29 months. The most important aspect of the LY-004 data, which helps as far as making decisions for treatment for patients with relapsed refractory mantle cell lymphoma, is efficacy and duration of response data. This calls to mind a patient who was recently started on CALQUENCE. Unfortunately, this patient had a very short duration of response to frontline chemoimmunotherapy. Patient was subsequently started on CALQUENCE and was noted to be in a complete response at first interim assessment after 3 months of therapy. Now let's take a look at the safety data from the trial. In the long-term analysis with a median follow-up of 38.1 months, the safety profile of CALQUENCE was consistent with the initial analysis. The most common treatment-emergent adverse events occurring in greater than or equal to 20% of patients were infections, headache, diarrhea, bleeding events, fatigue, cough, myalgia, and nausea. CALQUENCE has demonstrated low rates of atrial fibrillation and hypertension in the LY-004 study. At the long-term analysis, with a median follow-up of 38.1 months, atrial fibrillation was 1.6% for all grades and 0% for grade 3 or higher. And hypertension was 4% for all grades and 1.6% for grade 3 or higher. At the interim analysis, with a median follow-up of 15.2 months, atrial fibrillation was 0% for all grades or grade 3 or higher, and hypertension was 2.4% for all grades and 0.8% for grade 3 or higher. These data are consistent with what I see in my clinical practice. Safety continues to be an important aspect of any continuous therapy. The long-term data from LY-004 continues to support the safety of CALQUENCE in patients with relapsed refractory mantle cell lymphoma. The adverse reactions noted are all generally managed with the assistance of the healthcare team. Few patients discontinued therapy due to adverse reactions. In the initial analysis, dose reductions due to adverse reactions were reported in 1.6% of patients, and 6.5% of patients discontinued therapy due to adverse reactions. Median duration of therapy was 16.6 months, with a range of 0.1 to 26.6 months. At the 38-month median follow-up, dose reductions due to adverse events were reported in 2% of patients, and 11% of patients discontinued therapy due to adverse events. In LY-004, 8 out of 10 patients with relapsed refractory mantle cell lymphoma responded to CALQUENCE with a 29-month duration of response at the 38-month median follow-up. At a median follow-up of 15.2 months, the most common adverse reactions occurring in greater than or equal to 20% of patients with CALQUENCE were anemia, thrombocytopenia, headache, neutropenia, diarrhea, fatigue, myalgia, and bruising. The safety profile remained consistent over time, as demonstrated in the initial analysis and observed with the 38-month data, including low rates of atrial fibrillation and hypertension. The 3-year follow-up data from the LY-004 study is consistent with what I see in my clinical practice. Thanks for watching. Stay tuned for full important safety information for CALQUENCE.
Indications and usage. CALQUENCE is a Bruton tyrosine kinase BTK inhibitor indicated in combination with bendamustine and rituximab (BR) for the treatment of adult patients with previously untreated mantle cell lymphoma (MCL) who are ineligible for autologous hematopoietic stem cell transplantation (HSCT), and as monotherapy for the treatment of adult patients with MCL who have received at least one prior therapy. Important safety information about CALQUENCE. Acalabrutinib tablets. Serious and opportunistic infections. Fatal and serious infections, including opportunistic infections, have occurred in patients with hematologic malignancies treated with CALQUENCE. Serious or grade 3 or higher infections, bacterial, viral, or fungal, occurred in 32% of 1,764 patients exposed to CALQUENCE in clinical trials, most often due to respiratory tract infections. 19% of all patients, including pneumonia in 9%. These infections predominantly occurred in the absence of grade 3 or 4 neutropenia, with neutropenic infection reported in 2.7% of all patients. Opportunistic infections in recipients of CALQUENCE have included, but are not limited to, hepatitis B virus reactivation, fungal pneumonia, pneumocystis jirovecii pneumonia, Epstein-Barr virus reactivation, cytomegalovirus, and progressive multifocal leukoencephalopathy, PML. Consider prophylaxis in patients who are at increased risk for opportunistic infections. Monitor patients for signs and symptoms of infection and treat promptly. Hemorrhage. Fatal and serious hemorrhagic events have occurred in patients treated with CALQUENCE. Major hemorrhage, serious or grade 3 or higher bleeding, or any central nervous system bleeding occurred in 4.4% of patients, with fatal hemorrhage occurring in 0.2% of 1,764 patients exposed to CALQUENCE in clinical trials. Bleeding events of any grade, excluding bruising and petechia, occurred in 40% of patients. Use of antithrombotic agents concomitantly with CALQUENCE may further increase the risk of hemorrhage. In clinical trials, major hemorrhage occurred in 7% of patients taking CALQUENCE without antithrombotic agents, and 4% of patients taking CALQUENCE with antithrombotic agents. Consider the risks and benefits of antithrombotic agents when co-administered with CALQUENCE. Monitor patients for signs of bleeding. Consider the benefit-risk of withholding CALQUENCE for 3 to 7 days pre- and post-surgery, depending upon the type of surgery and the risk of bleeding. Cytopenias. CALQUENCE can cause grade 3 or 4 cytopenias. Grade 3 or 4 cytopenias include absolute neutrophil count decreased 26%, platelets decreased 10%, hemoglobin decreased 10%, and absolute lymphocyte count decreased 10% in patients treated with CALQUENCE alone or in combination with obinutuzumab. Grade 4 neutropenia developed in 14% of patients. Monitor complete blood counts regularly during treatment. Interrupt treatment, reduce the dose, or discontinue treatment as warranted. Second primary malignancies. Second primary malignancies, including skin cancers and other solid tumors, occurred in 18% of 1,764 patients exposed to CALQUENCE in clinical trials. The most frequent second primary malignancy was non-melanoma skin cancer, reported in 10% of patients, followed by other solid tumors in 9%, including melanoma, lung cancer, gastrointestinal cancers, and genitourinary cancers, and hematologic malignancies, 1%. Monitor patients for the development of second cancers and advise protection from sun exposure. Cardiac arrhythmias. Fatal and serious cardiac arrhythmias have occurred in patients treated with CALQUENCE. Grade 3 or 4 atrial fibrillation or flutter was reported in 2.6% of 1,764 patients treated with CALQUENCE, with all grades of atrial fibrillation or flutter reported in 7% of all patients. Grade 3 or higher ventricular arrhythmia events were reported in 0.6% of patients, including fatal cases in 0.3% of all patients. The risk of arrhythmias may be increased in patients with cardiac risk factors, hypertension, previous arrhythmias, and acute infection. Monitor for symptoms of arrhythmia, for example, palpitations, dizziness, syncope, dyspnea, and manage as appropriate. Hepatotoxicity, including drug-induced liver injury. Hepatotoxicity, including severe, life-threatening, and potentially fatal cases of drug-induced liver injury, DILI, has occurred in patients treated with Bruton tyrosine kinase inhibitors, including CALQUENCE. Evaluate bilirubin and transaminases at baseline and throughout treatment with CALQUENCE. For patients who develop abnormal liver tests after CALQUENCE, monitor more frequently for liver test abnormalities and clinical signs and symptoms of hepatic toxicity. If DILI is suspected, withhold CALQUENCE. Upon confirmation of DILI, discontinue CALQUENCE. Adverse reactions. Previously untreated mantle cell lymphoma. The most common adverse reactions, greater than or equal to 15% of any grade in patients with previously untreated MCL who received CALQUENCE plus BR, were rash, 47%, COVID-19, 38%, fatigue, 37%, diarrhea, 37%, pneumonia, 31%, headache, 31%, upper respiratory tract infection, 30%, pyrexia, 29%, cough, 27%, vomiting, 26%, constipation, 25%, hemorrhage, 20%, edema, 20%, secondary primary malignancy, 19%, dizziness, 18%, arthralgia, 18%, and dyspnea, 17%. Grade 4 laboratory abnormalities in greater than 15% of patients treated with CALQUENCE plus BR include lymphocytes decreased, 26%, absolute neutrophils decreased, 36%, and uric acid increased, 17%. Serious adverse reactions occurred in 69% of patients who received CALQUENCE plus BR. Serious adverse reactions reported in greater than or equal to 2% of patients were pneumonia, 23%, includes COVID-19 pneumonia. COVID-19, 20%, includes COVID-19 pneumonia. Second primary malignancy, 7%. Pyrexia, 6%. Rash, 3.4%. Febrile neutropenia, 3.4%. Atrial fibrillation, 3%. Sepsis, 2.7%. And anemia, 2.4%. Fatal adverse reactions that occurred within 30 days of the last study treatment were reported in 12% who received CALQUENCE plus BR, including COVID-19, 6%, includes COVID-19 pneumonia, pneumonia, 1%, second primary malignancy, 0.7%, sepsis, 0.3%, and pneumonitis, 0.3%. Adverse reactions led to permanent discontinuation of CALQUENCE in 43%, dosage interruptions in 74%, and dosage reductions in 10% of patients. Adverse reactions that resulted in dosage modification in greater than 10% included infections, cytopenias, rashes, and gastrointestinal toxicity. Adverse reactions which resulted in permanent discontinuation of CALQUENCE in greater than or equal to 4% of patients included COVID-19, includes COVID-19 pneumonia, and neutropenia. Previously treated mantle cell lymphoma. The most common adverse reactions, greater than or equal to 20% of any grade in patients with relapsed or refractory MCL exposed to CALQUENCE were anemia, thrombocytopenia, headache 39%, neutropenia, diarrhea 31%, fatigue 28%, myalgia 21%, and bruising 21%. The most common grade greater than or equal to 3 non-hematological adverse reaction reported in at least 2% of patients was diarrhea, 3.2%. Treatment emergent decreases, all grades of hemoglobin, 46%, platelets, 44%, and neutrophils, 36%, were based on laboratory measurements and adverse reactions. Dose reductions or discontinuations due to any adverse reaction were reported in 1.6% and 6.5% of patients, respectively. Increases in creatinine to 1.5 to 3 times the upper limit of normal, ULN, occurred in 4.8% of patients. Drug interactions. Strong CYP3A inhibitors. Avoid co-administration of CALQUENCE with a strong CYP3A inhibitor. If these inhibitors will be used short-term, interrupt CALQUENCE. After discontinuation of strong CYP3A inhibitor for at least 24 hours, resume previous dosage of CALQUENCE. Moderate CYP3A inhibitors. Reduce the dosage of CALQUENCE to 100 milligrams once daily when co-administered with a moderate CYP3A inhibitor. Strong CYP3A inducers. Avoid co-administration of CALQUENCE with a strong CYP3A inducer. If co-administration is unavoidable, increase the dosage of CALQUENCE to 200 milligrams approximately every 12 hours. Specific populations. Based on findings in animals, CALQUENCE may cause fetal harm and dystocia when administered to a pregnant woman. There are no available data in pregnant women to inform the drug-associated risk. Advise pregnant women of the potential risk to a fetus. Pregnancy testing is recommended for females of reproductive potential prior to initiating CALQUENCE therapy. Advise female patients of reproductive potential to use effective contraception during treatment with CALQUENCE and for 1 week following the last dose of CALQUENCE. It is not known if CALQUENCE is present in human milk. Advise lactating women not to breastfeed while taking CALQUENCE and for 2 weeks after the last dose. Avoid use of CALQUENCE in patients with severe hepatic impairment, Child-Pugh Class C. No dosage adjustment of CALQUENCE is recommended in patients with mild, Child-Pugh Class A, or moderate, Child-Pugh Class B, hepatic impairment. Please see full prescribing information, including patient information.